Atrial fibrillation is perhaps the most common arrhythmia or irregularity of the heart that we see as doctors in hospital. In the normal heart, we have a little pacemaker at the top that sends an impulse down to the bottom of the heart, so the heart beats in a synchronized, coordinated fashion. So the top part beats, the bottom part beats, top part beats, the bottom part beats, and that's a normal heart rhythm, what we call sinus rhythm in cardiological language. In atrial fibrillation, what happens is that the atria, which are the top chambers of the heart that push blood to the bottom of the heart, aren't contracting in a normal way like this. What they're doing is have a random electrical activity. So they're wobbling around a bit like jelly at the top. So they're not beating in a normal, regular fashion. That causes the bottom part of the heart, therefore, to beat in a often fast and irregular fashion. So that's what atrial fibrillation is in essence from an electrical and mechanical point of view for the heart. It then results in a whole host of symptoms that patients can experience. So they most commonly might experience palpitations. They may be breathless, they can feel dizzy, they might sometimes have chest pain, and so forth. So these are sort of common symptoms that somebody with atrial fibrillation may present with. In the vast majority of individuals, atrial fibrillation is not an inherited condition or is not a condition that is seen in childhood. There are a few very rare conditions where there are inherited abnormalities that can increase your chance of developing atrial fibrillation, but in the vast majority, it is an acquired condition. So what causes atrial fibrillation? So first of all, it gets more and more common as you get older. So that's one group. So age would be a risk factor. So in 60s, 70s, and 80-year-olds and so forth beyond would have more and more atrial fibrillation each decade. So age is the first and most common risk factor. Having blood pressure, hypertension, is another very important cause and contributor to atrial fibrillation, and probably one amongst the most common causes of atrial fibrillation. One of the increasingly important and recognized causes of atrial fibrillation is our weight. So as you get heavier and heavier, and particularly as you enter what we call an obese range, that increases your chance of atrial fibrillation. But on the other hand, if you lose weight and come back to a lighter or more normal weight, the frequency of atrial fibrillation also reduces, because weight puts an increased stress on the top chambers of the heart, the atria, which is causes them to behave in an imperfect manner and cause atrial fibrillation. Another cause that is quite commonly seen, perhaps in somewhat younger people, is alcohol. So alcohol, particularly if there are large amounts taken or taken in a sort of binge form, for example, on Fridays and Saturday evenings when people are going out, that is a trigger for atrial fibrillation. But more generally, any kind of heart disease, so if you've had a heart attack before, if you've got something called heart failure, or if you have sort of valve disease, they can all increase the chances of you suffering atrial fibrillation. So in summary, there's a wide range of causes for atrial fibrillation, some of which are sort of lifestyle and simple conditions that can be treated, some of them associated with things that are other heart problems. And of course, as we get older, we're more likely to develop it. So atrial fibrillation is an important condition to be evaluated and treated. It's not something that should be ignored. There are two reasons for this, really. The first and perhaps most serious reason is that in a number of patients, the presence of atrial fibrillation will increase their risk of stroke. It can increase the risk of stroke about 5 times higher than average. So that increased stroke risk needs to be recognized if that individual is at elevated risk of stroke, and that needs to be treated. And it's easily treated with a range of medications that we have now that can reduce that risk of stroke by around 70%. So you can really reduce your risk of stroke. And I certainly know amongst my patients, the risk of stroke and worrying about having a stroke is something that they really worry about, and it can be prevented. So that's important. The other side of atrial fibrillation is the symptoms and the impact on an individual's quality of life. So they may become have palpitations, the heart's racing, they get breathless, they may have chest pain, dizziness, fatigue, and all these different symptoms can really affect people's ability to do the things they want to do, go out for walks, enjoy themselves with friends and family, and so forth. And so that's the other reason for atrial fibrillation to be treated. And that can hopefully have a very useful impact on people's day-to-day lives. So stroke reduction, quality of life are the major reasons for it to be investigated and treated. Atrial fibrillation, for many people, does cause symptoms. They may not recognize it to be atrial fibrillation, so they may think, oh, I'm getting older, I'm getting tired or more breathless, and not associate it with atrial fibrillation. But in a fairly large number of individuals, it's picked up by chance, incidentally. And so there are quite a lot of people who we see who have atrial fibrillation but never knew about it. And so in those individuals, it's important that they are screened regularly, just when they come, for example, for a flu jab or go and have their blood pressure checked, and somebody just checks their pulse and goes, oh, look at that, it's irregular. Sometimes they'll come up for another procedure in a hospital, and maybe a pre-operative assessment, and atrial fibrillation is picked up. So, I definitely see patients every single week where AF was diagnosed by chance. The most worrisome scenario where AF is picked up is when, sadly, a proportion of these patients present with a stroke, and then you think, oh gosh, they had atrial fibrillation. If only we'd picked it up earlier and prevented it with treatment. But yes, patients definitely can have atrial fibrillation where it can be picked up by chance by others. So regular, checkups on individuals when they come for other things is very useful in picking up atrial fibrillation. So in patients who have palpitations and who may have a very irregular pulse, it's really important that the diagnosis of atrial fibrillation is made properly, and it's done by an ECG. So an ECG typically will capture this irregular behavior of the atria and show that they're fibrillating, and you can see that on an ECG. In other patients, the atrial fibrillation isn't there all the time. It comes and goes, something called paroxysmal atrial fibrillation. And therefore, the day you have your ECG, it might be normal. So what we need in those individuals are other ways of capturing the atrial fibrillation when it's there. And there are probably two broad ways that is done now. So firstly, there are monitors that one can apply or fit to an individual that they will wear for a number of days, say, for example, a week, where if the atrial fibrillation comes up during that period of monitoring, then you can diagnose it because you can see that abnormal atrial activity and that irregular behavior of the bottom of the heart. And you say, they got atrial fibrillation at this time. The other way, increasingly used by some patients, is using devices that they have at home. So they may have a smartwatch, such as an Apple Watch or another kind of watch that can capture the ECG on the watch. And so they will have an ability, when they have palpitations, to record an ECG, and they can send it to their doctor, and that sometimes can diagnose atrial fibrillation. Or alternatively, there are other devices that people can buy, which are small, that they can carry with them and works with their smartphone and can record an ECG when they have symptoms. And again, I have a number of individuals where atrial fibrillation has been diagnosed with their device that they have at home. So there's a range of ways of diagnosing atrial fibrillation, but all require some form of ECG recording to confirm the diagnosis. Because without confirmation, you can't go ahead and give the other treatments or the many treatments that are available for atrial fibrillation.